Logo, 3M. Text, Science. Applied to Life. Module 4. Pressure Injury Assessment. Image of a therapist massaging a man's foot.
In Module 4, we will discuss best practices and recommendations for conducting a pressure injury assessment. Risk assessment tools are an essential component of a pressure injury prevention program. Although most clinicians have the ability to instinctually determine which patients could be at risk of developing a pressure injury, risk assessment tools are designed to quantify this risk. Studies have demonstrated that these assessment tools can be more reliable than clinical judgment alone.
Text, Risk Assessment. Use of validated risk assessment tools such as the Braden Scale. A chart consisting of the 4 levels of 6 risk factors.
One of the most used and validated tools for risk assessment is the Braden Scale. It divides risk factors into 6 subscales: sensory perception, moisture, activity, mobility, nutrition, friction, and shear. The assessed risk level of these subcategories are added together to calculate overall risk. The level of risk will help guide clinical interventions. The frequency of risk assessment depends largely on the care setting and the patient condition. Best practices recommend a complete assessment upon admission, at the time of condition changes, and at regular intervals outlined by your facility's policies. Assessing a patient for pressure injury risk involves a complete head-to-toe assessment, focusing on bony prominences in the patient's dominant position.
An illustration of the back side of a body with red target circles representing areas of bony prominence. Text, Dasent E, Danon A, Lawman N. Pressure Ulcer, The Scale of the Problem in, Roman Lem. Editor. Science and Practice of Pressure Ulcer Management. London. Springer Verlag, 2006, pages 1 through 6.
It is important to check around medical devices and ensure proper documentation according to your facility protocols. When assessing patients, examine areas that are known to be at high risk of developing a pressure injury, such as the sacrum and heel.
Text, How to assess a pressure injury. Common locations include sacrum, heels, ankle, elbow, hip, and ischium.
Additionally, pay close attention to areas such as ankles, elbows, hips, and the ischium in patients that are wheelchair dependent. If the patient requires use of medical devices, carefully assess the skin around and under the device. Examine areas such as the ears, nose, and mouth. If there is an open wound or area of concern, document the findings according to your facility's policy.
Text, Skin Assessment. Look in, under, and around medical devices. Image of a medical professional's surgically gloved hands probing a patient's ear.
Conducting a thorough skin assessment may require removal of medical devices, including tubes, braces, splints, and compression stockings, and may require more than one staff member to ensure patient safety. When assessing the patient, make sure to also inspect between digits and skin folds.
An image of indentations and lines on a patient's back caused by the pressure of medical devices.
Consider non-medical devices like phones, hearing aids, eyeglasses, cords, and call lights as risk factors, as they can easily be sat on or tucked into skin folds that may contribute to the development of pressure injuries.
Text, Skin Assessment. 5 key factors of a skin assessment: color, temperature, texture, pain, and moisture.
Other elements of a comprehensive skin assessment include assessing skin for redness, both blanchable and non-blanchable, or areas of purplish discoloration. In darkly pigmented skin, color differences may be difficult to distinguish. Changing skin temperature. Changes in the texture of the skin and surrounding tissue, such as induration or hardness, swelling, or edema. Consider pain discomfort for patients with intact sensation. Excess moisture and maceration of the skin due to diaphoresis, incontinence, or other drainage. Thank you for watching Module 4, where we discussed pressure injury assessment. We hope you will join us for the next module.
Logo, 3M. Text, Science. Applied to Life. 3M 2022. All rights reserved.